Okay, so here are some of my makeshifty things. This is going to serve as my lidocaine container. This is going to be my pretend needle and syringe. This is a little perineal tear that I made with a tampon, and we want to approximate those tissues together. This is actually going to be my alcohol pad, and then I have sort of my little sterile instruments and stuff over here. I hope it's okay that I just go ahead and show you the movements for the gloving and all that kind of stuff. So, and I wasn't sure, I guess I'm gonna try to do this without an assistant so that I can show you how all of that goes. It's sort of weird for me to think about how to do that without an assistant because obviously that's ideal and usually what I see happen, but I will do my best. So if I'm doing this myself and not an assistant, usually this is the assistant's part, with clean gloved hands, we're going to go ahead and take the lidocaine, remove the lid off of the lidocaine, take the alcohol swab, and clean thoroughly the little rubber area. And then we're going to take the needle that we want to use and syringe, remove the lid, and then I'm going to set that down. I'm going to go ahead and create the same amount of air by pulling the plunger down on the needle of however much agent I want to use to be actually in this needle. So I'm going to go ahead and pull the plunger down to as far as I want it to go. And once that's done, I'll go ahead and grab my lidocaine again. And I'm going to go at about a 45-degree angle into the rubber area here. And with the pointed edge closest to, like, that's the part of puncturing into the rubber. So I'm going to go ahead and once I'm punctured in there, then I can go ahead and just level it out where they're parallel together. And I'm going to go ahead and push all that air out and then go ahead and fill it up with the agent that I want by pulling the plunger back down again. And once that's completed, then I'll go ahead and take this off and set that away. And I can scoop up the lid to the needle and go ahead and push it down so that I'm being safe with the needle as possible. And at this point, I'm the one doing all the things. So I have my sterile instruments here. As you can see, there's a couple different layers that we usually use. So I'm just going to go ahead and lift that up and just throw that in there so that I'm maintaining sterile area over here. And the less sterile stuff is just right underneath there. I can go ahead and get rid of the gloves that I had on and put on my sterile gloves. So I'm going to go ahead and take out the plastic bit, and then I'm going to open up just touching the edges. Go ahead and grab the first glove from the inside of the cuff. So the cuff is up this way. So I'm going to grab it this way, pull it on, and then now I'm going to take my sterile gloved hand and go from the outside, I guess you would call it, of the cuff, and then put that on. And now I have my sterile hands. And I can use the inside here of my pack. And I'm going to grab the needle again, remove the lid, and I can go ahead and start administering the lidocaine. Now, this is also too where again we would have usually an assistant that would get the hibiclens in water, obviously check on the side of their thigh first for temperature, and then give another little spray over top of everything. And then I can use, as the assistant does that, I can use the gauze that I have here to go ahead and wipe clean any extra clotting, extra blood, or anything that might be in the way of my vision. And, obviously we're putting this away in the right place once we're done using it. So I'm gonna go ahead and first go to the subcutaneous layers, the areas that, so we have these edges here that we want to have come approximating. So we're going to start with those edges here and do just sort of just underneath the superficial layer of those tissues. So then I'm going to come in as parallel to that as I can. And I'm going to start with a little bit of a puncture, and then I'm going to depress for like half a milliliter or whatever of fluid. And then I'm going to move through that fluid and continue to do that. And I'm going to go as close to the edge as possible and go to as far back as I'm going to need to go on either side with the stitches. So if I know I'm going to be suturing that far back, I want to go that far back. I'm going to do that with each side. And now that I've got the subcutaneous layers treated, then I can go into the deeper layers of these tissues here. So there's a couple different ways that that can be done. The way that I usually see it done is the fanning technique way. I know that that's not Fry's favorite, but I'll start with that one first. So we go into the deeper layer at more of an angle, just go right in there. And I'm going to depress fluid as I pull. So let's start here. I'm sorry. I'm going to go down first, and then I'm going to depress fluid as I pull the needle out, but not completely out, because then I'm going to go back in another angle. And then I'm going to depress fluid as I come back out, but not completely out. And I'm going to do that another 1 or 2 times and just try to reduce the amount of pokes that I'm doing. And then periodically I'm going to aspirate the needle just to kind of see whether or not I'm hitting a blood vessel. So if I see blood coming back as I aspirate, then I know that I need to make sure that I readjust my needle before I go ahead and add more lidocaine in there. So I'm going to do that on each point. So I'm going to do a fan here, and then probably a fan back here. Just kind of depends on how deep the areas are and where I know I'm going to be sticking my needle, that I want to make sure that they're not going to be in, the least amount of pain as possible. And that would be one method for getting those deeper tissues. The other method that Fry prefers requires more pokes, but apparently is less, uses less agent and maybe easier to numb more difficult areas. Like, for example, if you were doing a 3-degree tear where you had more rectal tissues that you had to try to numb. So what she does is she just does a poke on the out, like it's several pokes basically on the outer layer here, but we're just doing a poke, and then we're gonna depress the needle. It's hard to do this and show you at the same time. Do a little poke, depress the needle, done. Little poke, depress the needle, done. And then we're just going to do that several times in the areas that we need to get to for these deeper tissues. That is what I know about administering lidocaine to a client.